Welcome, everybody. Thanks for joining our webinar. This webinar is a part of the series within the framework hosted by the National Center for Pyramid Model Innovations. I'm Lisa Fox, and I am the project director for NCPMI, and I'm going to participate in it as a panelist in this discussion. So today we're going to talk about the role of the infant early childhood mental health consultant in supporting the pyramid model. So I'm really excited today to have our two other panelists besides myself to talk about this topic. I'll let them say hello to everyone. So we have Neil Horan, who's with the National Center for Excellence on Infant Early Childhood Mental Health Consultation.
Hi, everybody. Glad to be here. Thanks, Lisa, for having us.
For sure. And then we have Amy Hunter from Georgetown University. Amy is also a consultant with NCPMI.
Hi, Lisa. Thanks for having us. It's great to be here. I'm excited to share this information today.
Good. So in this conversation, we're going to explore the role of the infant early childhood mental health consultant in the implementation of the pyramid model. I think it's probably the first of many conversations we might want to have about infant and early childhood mental health and the pyramid model. As early childhood programs and early intervention programs begin implementing the pyramid model or are engaged in that implementation, we believe that the mental health consultant could be a really valuable partner. That consultant could be involved on the community level in bringing initiatives, collective initiatives to the community around promoting young children's social, emotional, and mental health, as well as the consultant might guide program-wide implementation, or be a part of a leadership team that is actually doing implementation of the pyramid model. Those are just some ways that we believe that people who are in roles of infant and early childhood mental health consultants may encounter pyramid work and facilitate pyramid work. But before we get too deep, Neil, why don't you talk to us about what is an infant and early childhood mental health consultant and what these consultants do?
Sure. So I think you're moving the slides for me, if I remember right.
Yes.
I'm going to try.
Wow.
Nope, it's going to have to be you. My magic's not working. So this is a picture of what Amy and I look like when we first started talking about mental health consultation. So, I think that, Lisa, it's a great topic for us to be discussing because so many folks out there who are implementing the pyramid model are talking about, well, how is this the same? How is it different? And I think the more clear we can be about what each of these are, and I like that the title of what we're talking about today is about partnering, because that's really key. And I think in many ways, and I was sort of looking, I have some friends here in terms of the participants that I see, those folks seem to understand this actually better than others. I think that folks are really trying to figure out, how does this all fit? And so I would like to just take a few minutes to talk some definitions around infant and early childhood mental health consultation. First, I think it's important that folks understand that this is an evidence-based practice. There is a fantastic randomized control study that was done in a program in Connecticut. And there's a great deal of evidence from any number of programs across the country and a number of places that have really strong outcome data. And so it's important to keep that in mind, because we're talking about something that is from our perspective, a key component of a well-functioning early childhood system within a state, tribal, nation, territory, community. Some of these slides are slides that are actually available in our website on the Center of Excellence. And it's important to understand that the role of the consultant is really to help support caregivers. In early care and education, we know that mental health consultation is happening in childcare and early Head Start and Head Start. It's happening in home visiting. It's happening in a number of places. But particularly when we think about early care and education, it's important to understand that the mental health consultant's role is not to do therapy. It's not to fix children. It's really to help whoever is working with that child and their family do as good a job as they can to understand social emotional development, to enhance it, to support it, to give those caregivers the kinds of tools that they need that will really improve their practice within their classrooms, within the settings that they're working in. And it really is about sort of a way of helping children be in the best place that they can be in order to develop to their full potential. It is important to think about this in terms of what it is and what it isn't. And I think when we have words like mental health and consultation, that people sort of have lots of different conceptualizations of that. And so it's important, and we have a slide where we talk about this quite a bit, because if you're going to implement mental health consultation, and in particular, if it's happening in a place where the pyramid model is being implemented, we want everyone to be very clear. So as you can see, and I don't need to read to y'all, but as you can see, there are some things that when we talk about high quality, evidence-based infant early childhood mental health consultation, there are things that we think it is, and it's an indirect service. It is really quite similar in terms of pyramid model, in terms of being more about promotion and prevention than it is about treatment. We do have some set of competencies that we'll talk about that really are about folks needing to be at least having a master's prepared. And you'll see in terms of what it isn't, that there are a number of things to be clear. And I say this all the time. There may be mental health consultants who do some of these things. Everyone should be clear that when they're doing it, that's not mental health consultation. I'm well aware, having been to lots of places, that it's not so easy to find somebody to do therapy, and to find somebody to do pyramid model, and to find somebody to do mental health consultation. So sometimes people are playing multiple roles, but in truth, mental health consultation does not involve direct service or therapy. It is not group therapy, it's not treatment, it's not training and technical assistance. It really is this indirect service in which we're trying to support those adults who are working with young children and their families. So I hope that is a quick overview of probably 20 years worth of work and a great deal of work that we're doing at the Center of Excellence. And certainly we are going to encourage folks to look at all that work, but that's a quick overview of what mental health, infant and early childhood mental health consultation is.
Great, thanks. So what I want to do is guide us to think about then, how does the infant early childhood mental health consultant intersect with the pyramid model? So the pyramid model, it seems highly consistent with the notion of promotion and prevention, right? The pyramid model is a framework of evidence-based practices that's about promotion, prevention, and intervention for kids who have behavior support needs or social emotional delays. It's really important that we all think about it as a framework, because a framework flexes and includes other models, approaches, practices, as well as new science. And hopefully we're always discovering new science that can help us with this really important work. I think it's also, as we think about the infant and early childhood mental health consultant, we also ought to think about how we bring the pyramid model to a program, because I think that might be where they're key. So the pyramid models brought to a program, either an early intervention program or an early childhood program, by a leadership team that pays attention to making sure we have all of these pieces. So making sure that staff are on board, that we have family engagement, that we have responses for kids who have more intensive support needs, that we're doing continuous professional development and coaching, and using data for our decision making. And a group of professionals, as well as a family member and a practitioner, work together as a leadership team to make that happen. So I'm thinking, and Neil, I'm interested in your thoughts about that the infant early childhood mental health consultant, if they're operating or in the community or operating with a system or a program, could be really pivotal in this kind of work.
Yeah, so it's good to think about it in that way, because as I'll describe here, there are a lot of different types of mental health consultation services. And if we think about a program-wide implementation and what the leadership team is doing, having somebody available to support at a programmatic level what's happening, such as a mental health consultant, can really be instrumental in being clear for the leadership team, being clear for staff, being clear for everyone. What is it that we're trying to do? We're trying to implement the pyramid model. What's the role of the mental health consultant? Well, it really can be very distinct in terms of there are things that a mental health consultant might do that might be different than what, say, a pyramid model coach does. On the other hand, a mental health consultant can be quite instrumental in terms of supporting those administrators. And we've seen some great examples of this across the country in terms of what are you trying to do at a programmatic level, and what is the piece that the mental health consultant can bring. So I think your question, Lisa, is really, strongly tied to how we think about programmatic consultation in some ways. I mean, I think that there are a variety of ways in which programmatic mental health consultation happens. It certainly is about a much larger picture, which when I think about all the program-wide implementation of the pyramid model, it is about how do we get everyone to be on the same page, buy-in, all those kinds of things. And so that's one particular type of consultation. As you can see, there are two others here, and you know, a classroom or a group. We obviously, as we think about mental health consultation being implemented in places outside of early care and education, such as home visiting, primary care, child welfare, there's a number of places where it's being implemented, that it's important to start to think about what are the different levels in which this happens. So as we move from programmatic to a classroom-centered sort of consultation, working directly with those providers, trying to identify what's going on. This is where a lot of work, both at a programmatic but also at a classroom level, around implicit bias, equity issues, those kinds of things might be addressed. And then I think for many folks, child and family-centered consultation is where it feels like, that's what a consultant does. We have a child who's having difficulty. We call the consultant, they come in and tell us what to do, which is not exactly how that works, but it is much more focused sort of child by child, whereas classroom or programmatic consultation takes a much wider lens and is really about impacting everyone's practice, not just what we're going to do about a particular child. But again, I think many folks who are familiar with both consultation and the pyramid model will see some of those parallels. So I just want to talk a little bit about some of what we found in terms of child level outcomes. And again, as I mentioned, in terms of the research and outcome data that we have here, we do know that this has, mental health consultation has been shown to help with the prevention of suspensions and expulsions, which I would imagine of the 100 people on this call, probably about 100 of you are concerned about that issue, as Amy, Lisa, and I are. And so we know that this can certainly, using mental health consultation can impact children's challenging behaviors, but it also does things like improve that relationship. And we know that the dyadic relationship, the relationship between the adult and that child, is critical, and there is that parallel process that sort of happens at home and in other places. And so knowing that some of the data is indicating that it helps prevent suspensions and expulsions, it improves that relationship, and obviously the corollary, which is not an easy word for me to say at 3 o'clock in the afternoon on the East Coast, the corollary is it helps with things that probably appeal to people outside of our circle. You know, our circle is very interested in those first two. The rest of the world, all my fantasy football buddies, are interested in things like reducing missed work for parents. They're interested in the sort of financial impact and things, and that's one of the ways in which we sort of talk about the value of infant and early childhood mental health consultation, is that it can have a pretty big impact. And again, I think as we think about program-wide implementation of the pyramid model and how the partnership between the two works, these kinds of things, as you can see here, these are not outcomes that you'd say, well, I've never heard of those, I only do pyramid model. You obviously look at those and say, that seems familiar for me as well. So I just want to sort of throw those things out there.
Yeah, that's so encouraging. And I'm excited about the outcome data around preventing suspension and expulsions. That's a huge foci for the National Center for Pyramid Model Innovations. And actually, the Pyramid Equity Project, a project that we just completed, has shown that when people implement the pyramid model with fidelity, we don't have preschool suspensions and expulsions. So it's really exciting that we can address this really troubling issue of inappropriate discipline practices together. I don't know, Amy, you want to unpack that a little bit more for us about how you address issues of equity and culturally responsive practices? Because I think that's really at the heart of some of the issues people are talking about when we see disproportionality in inappropriate discipline practices.
Sure, thanks, Lisa. Yes, Neil mentioned a little bit about the research, and the research related to pyramid model and mental health consultation really shows that both of those approaches prevent expulsions and suspensions, which is really exciting. I see you have put up a slide here around competencies related to mental health consultants. We actually have, and these competencies, you can find them. It's impossible to read the little font on the screen, but this could be your homework from the webinar. Go to the Center of Excellence for Infant Early Childhood Mental Health Consultation, and this is one of two places you can find these competencies for mental health consultants. But I highlight these here based on your question, Lisa, because we have a whole section on equity and cultural sensitivity for competencies for mental health consultants. And these include some things like demonstrating the ability to explore and negotiate cultural differences. And so what do we mean by that? We really mean that the consultant builds relationships, trusting, safe, secure relationships with the folks that I say she, could be he, but that she works with to really unpack, as you said, what's behind some of the views and reactions that teachers or administrators might have about behavior. And we know that caregiving and discipline practices and developmental milestones and really the whole realm of caregiving and parenting and teaching is so heavily laden with culture and our cultural expectations and how do we expect children to behave, how do we view discipline, how do we view these things. And so the consultant can really help teachers not only to bring the information that we know about implicit bias and about suspension and expulsion, but really ask questions about, helping administrators sort of step back and think about how they view or why they view the behaviors in the way that they do, or their own personal experiences and expectations of children's behavior or discipline practices. So some of the other sort of competencies that we have consultants that they would bring are, demonstrating the ability to talk about these sort of sensitive or difficult topics, right? Helping people become aware of the things that stir them up and sort of raising those often things that are unaware feelings and reactions that people have if they don't have someone to sort of help them step back and really think about where those thoughts and those feelings and those reactions come from. They can often have unintended consequences. So I think those are some of the ways that consultants can really, help with expulsion and suspension. It's really a focus on helping people reflect and step back and, have tough conversations sometimes, but really necessary conversations.
Mm-hmm. That is so powerful, Amy. I think that's a really important point. And it feels like to do this work, we really need to get to that deep place, right? If we're really going to achieve systems change and change in our practices. I want to say to the group who's listening, we can entertain questions. We haven't had any questions yet, except tech questions. But if you have questions that you want folks to answer, please send them our way. I'm going to shift a little bit, Amy. I want you to Also share, I've become aware in my conversations with you, as well as reading that I'm doing around infant and early childhood mental health consulting. So we, as you know, have done a lot of work in pyramid model around the use of practice-based coaching to help people have both the confidence as well as the competence to use evidence-based practices to address children's social emotional skill development, as well as address behavioral issues or social emotional delays. But there's more that probably needs to happen with staff, and a huge movement, as well as some really interesting research, has kind of called out the importance of staff wellness. And I know that that's something that infant and early childhood mental health consultants are well equipped to help programs address. So will you talk about that a little bit?
Sure, happy to. It's such an important issue. And we hear often that, the pyramid, how helpful the pyramid practices can be. And sometimes folks get stuck around what's going on with the difficulty of implementing, staff having some difficulty. They're on board with the goals. They think the practices are great, but there's a whole other, sort of avenue to explore around, as you mentioned, how are staff doing, right? Staff need to be physically well, they need to be emotionally well to adopt the practices that we know are best for children's success and their social emotional development. And so this study was done in Pennsylvania in Head Start. They surveyed, it was Whitaker and his colleagues surveyed over 2,000 Head Start staff, mostly teachers, but all different staff, so not exclusively teachers. And he was really interested, or the team, I should say, was really interested in learning about staff's physical health and their emotional well-being, because they believed it related to the kinds of things they would be able to do to promote children's social emotional development. And so they asked all kinds of questions about physical health, things like asking about asthma, back pain, diabetes, obesity, high blood pressure. I think we have a slide that might highlight those. Yep, there we go. And what they found was that these physical conditions that relate to stress, that either stress may exacerbate these symptoms, or these conditions certainly can exacerbate stress, were quite high among the population of Head Start staff, and much higher in the Head Start population of staff than another normed sample. So what I mean by that is another sample that of folks who had similar income but did different work. And so this is really interesting, I think, when we think about what we're asking teachers to do and how they're feeling. They also asked a couple other questions about just sort of generally how they feel. And they found that 30% of Head Start staff reported feeling physically or mentally unhealthy more than 2 weeks out of the previous month. Mm. So, a month is 4 weeks. So half of that time they reported that they weren't feeling so well, either physically or emotionally. The other finding that they looked at was, this is a finding related to diagnosed depression. So they also looked at symptoms of depression, but this slide speaks to either Head Start staff or this nationally referenced sample that have been diagnosed. And you can see that in Head Start staff, that rate is much higher than in the nationally referenced sample. And this has some pretty, potential for significant consequences related to what we know about depression and caregiving. And so we know that when caregivers are experiencing depression, it could be that they are more harsh. There's research to show that, and that they have less interactions with children and less warmth in their interactions with children. And so this is really important to look at when we're asking folks to engage in practices that we know are best for children. And so the mental health consultant can really help, and Neil was talking about the different types of consultation, but programmatically, they can help the directors think about, how are staff in your program doing? What is the climate like to work in this program? What can you put into place to help staff feel more supported, to, put some wellness practices in place? Some programs have begun to do things like walking clubs or walking meetings, or some programs have employee assistance programs that staff can make use of in terms of their own well-being, their own counseling, referrals for all kinds of supportive services. Some programs we've heard engage in sort of mindful moments before they have a meeting. But there's all kinds of ideas about programmatically leaders recognizing staff, highlighting when staff, just like we do with children, right? Highlighting when staff are doing a great job. And then this slide refers to the same primary author on the last study, Bob Whitaker, also began to look at, in another study, mindfulness practices, and found that mindfulness practices helped reduce symptoms of depression, and also increased teachers' interactions with their children. And so this is a place where mental health consultants, again, in that programmatic consultation, can help think about, is there some mindfulness training that might be helpful, or, just really simple mindful practices, before you engage with a parent, before you engage in a meeting, can you take a couple moments to yourself? Can you practice some breathing? Can you use there's different apps on the phone, but all kinds of these strategies to really help teachers to, a phrase that certainly I didn't come up with it, but to be well, to be able to teach well, to be able to engage in those pyramid practices that we know make a difference for children.
That's great, really fascinating. We do have a question, and I'm going to hold it, but I wanted to acknowledge it. So we have a question around family that relates to family engagement. We're prepared to talk about that in just a minute. But before we go there, I want to bring up another topic, which is the exposure of children to trauma. As a field, I think we're becoming increasingly aware of the impact of trauma on children and their families. And as a consequence, I think across the country, we are all becoming interested in trauma-informed care and how we might use that. And those of us who are doing pyramid work, how does that intersect with the pyramid work? So can you talk about that? Neil, you want to talk about that a little bit and how that plays out?
Sure. It's interesting. I'd say 10 years ago, and as somebody who's been, working with you, Lisa, and with others in the pyramid model, I don't know 10 years ago if we ever talked about this. I think that we talked about a lot of things. I don't know that this was one of the things that we talk about. And I will say over the last 2 or 3 years, I think that's all I talk about. And, my wife was saying, why do we talk about trauma so much? Is there more trauma, or are we just more aware? And I sadly think it might be a little bit of both. And I think, unfortunately, we're probably going to keep talking about it. And lots of different kinds of trauma, some imposed by folks, some as we're all sitting here on the East Coast awaiting some that's imposed on us. But I think we've spent, folks who work on the pyramid model, folks who work in the mental health consultation world, we've really thought a lot about what's the shift that we have to make. And I always find it interesting, and I've been telling folks this last like 5 or 6 months as I'm going around doing presentations, that, we could talk about trauma all the time, and, we sort of talk to ourselves. But if Oprah Winfrey brings Bruce Perry on 60 Minutes and talks about it, a lot of people are paying attention. And I think it's great. I actually, all joking aside, because as you know, I'm always very serious, I think that that's been a great service for us, that there are people outside of our world who are paying attention. And I think that one of the things that Amy and I and others, when we talk about this, start to think about is a bit of a shift. And that shift really is a shift that I think the pyramid model has certainly helped folks think about. I think that mental health consultants are probably, the field of mental health consultation has probably been there for a while, but that that shift, I think, around we're not trying to just reduce a behavior or fix something. We're actually trying to do something vastly different. And so the pyramid model, when I think about the pyramid model, one of the things that I think about is that it's not just about there's something wrong and we need to reduce that behavior, sort of pure behaviorism. It's how do we understand what that behavior is all about, sort of the functional assessment that we always talk about. And instead of just trying to get a behavior to stop or be reduced, it's how do we really focus on learning new, helping someone learn new skills, better outcomes for all, and how that's sort of matched to what's going on. I think what's most important when you think about trauma, though, is to start to think about that phrase that hopefully most of you have sort of become familiar with, which is not to ask the question of what's wrong with you, but to say what happened to you. And in understanding what happened to somebody, you begin to start to understand that from a very different perspective. And a trauma-informed approach and how you sort of how you approach trauma through a pyramid model lens is really to focus on the understanding of that behavior and the teaching of new skills, but also healing. And I think that this is where mental health consultants, again, have had this sort of an approach. It's grounded in infant and early childhood mental health. That focus is no different. There are many aspects of the pyramid model that are very helpful for children and families and staff, quite honestly, who've experienced trauma. A lot of the environmental piece, the relationship piece, is core to how we address trauma, and understanding that there's healing that needs to happen, that we are now focused on the mental health outcomes. How do we sort of equip our children who've experienced trauma or are continuing to be exposed to trauma, their families, and our staff and the secondary trauma that they can experience? How do we focus on all the same sorts of goals and outcomes as well as those mental health outcomes? And how do we help those children sort of learn skills that they can use, whether they are sort of away from the trauma or continuing to experience it? But how do we sort of not just do some generalized intervention, but start to think about this child, this staff member, this family, whatever it is? How do we sort of attend to what their experience is and what they've done? And it's sort of, it's important because it has a lot to do with issues around attunement. How do we make sure that we're sort of in sync with the other person that we're working with? And I think that when we talk about trauma, it's really important that that we don't get lost. My sense is that everyone's running around talking about trauma and trauma-informed, and I'm not so sure that everybody understands it quite as fully as they need to. And we're doing some work on this right now with some vice principals here in DC, in 30 schools, around really understanding what are sort of the basic core building blocks that even could get to a point where you could start to talk about trauma. So at least I hope that that sort of got at what you're asking. I sometimes get completely lost in my own thoughts because I'm fascinated with myself.
Well, I think the topic's really fascinating, and
Yeah.
it feels like what you just shared with us just kind of begins to touch on it, but there's so much more that we need to both know and be aware of. And then people in early childhood programs and early intervention programs are, I think, keenly interested in really understanding that complexity.
Mm-hmm.
And I think this complexity may be pretty foundational to making some of the changes that we want to make, and to be able to support more fully children who seem to be difficult to reach and support, and families that seem to be complex for us.
Well, I think the other piece, quite frankly, Lisa, is I think it's important for folks, particularly folks who are in a classroom, folks who are frontline staff, that they don't come to a place where they feel like it's all on me. I'm supposed to know everything. I'm supposed to be an expert. Mm-hmm. It's quite the opposite. It's about knowing enough to know there's something going on here, and that this may be out of my sort of range of skills, sort of in the big picture around how do we get to some of those mental health outcomes. And how do I sort of do the things that I can do? How do I do some of the base of the pyramid? Or how do I work with my mental health consultant who can help me understand that the behavior I'm seeing has very little to do with me. It's not about me and this particular child, but it really is about something that's happened, that there are things I can do to be helpful, my environment, my relationship, and there are things, there are things that I probably need some assistance on that, in many cases, a mental health consultant can be quite helpful with.
Great, great. So I am going to shift gears a little bit, unless Amy, you have anything you want to contribute to the trauma discussion before we move.
Well, I mean, I think the one thing I would contribute to the discussion is how important the stories are to hear, and that. And I'm probably going to just give my next points away, but how, just how critical it is to serve the whole family, right? That when we have a child in our care, whether it's childcare or whether we're working with the family in early intervention, we're working with the whole family. The infant and the toddler didn't come walking into the program by themselves. Even the preschooler, right, that we're serving the whole family. And in order to be trauma informed, in order to truly understand the behavior or what we're seeing or get the fullest picture possible, we really need to hear from the families about, their story, about what's going on, about their circumstances. And so I would just add that to the, how important that is when we're being trauma informed to, really get the full story as much as possible.
So, Amy, let's just keep on the vein of talking about families, because that's what I want you to talk about next. And family engagement, that's really core to pyramid model implementation. I think we've paid a lot of attention to families as partners in the implementation of the pyramid model. So actually sitting on the leadership team and guiding implementation. We've also paid attention to families as partners and learning how to use pyramid practices at home and in the community to support their child. But we do hear from programs that sometimes they really have difficulty, that there are some families that are hard to engage. There are some families who feel like they might have needs that outstrip really the resources they have to provide, and they're really heartbroken about their inability, I think, to provide what those families need. And I'm thinking that may be where an infant early childhood mental health consultant could be really key. But you tell us what you think.
I'm thinking you're right. No, I think that's absolutely right. And I want to pick up on something you said, because whether we're talking about the pyramid model or we're talking about mental health consultation or high quality early childhood services, we really are talking about engaging families at the beginning, right? So if you're, sometimes programs get stuck and they completely, in an unintentional way, that they're talking to parents at a time when things have already sort of spun out a little bit. And, it's hard to engage a family at that time when people are already frustrated and when behaviors may have been, going on for a while, and when there hasn't been that relationship with the family established, from the very beginning. And so you hit on it when you were talking about family engagement with the pyramid model, but, really, I think the mental health consultant can help programs, again, in that programmatic lens, think about how does this program engage families from the very beginning? Are families welcome here? What does it feel like for all families to walk into this center? Or what does it feel like for this family when the home visitor comes to their home visit? And they can help programs reflect on that. Are pictures in the center reflective of all families? Is the material in different languages for families? So really thinking about, from that programmatic standpoint, how families are engaged across the whole program. You mentioned some good examples of those as well. the mental health consultant can also help sort of individuals who might be struggling with a particular relationship that they have with the family. They could help sort of brainstorm with that staff. Well, how are you going to set that conversation up? You know, how can you set that conversation up for success? You know, when is the conversation going to happen that the parent would be most comfortable? Where is the conversation going to happen? How are you going to start it? What could you say? What kind of open-ended questions can you use? How do you incorporate the parent in the agenda of the conversation? You know, what might the parent's perspective be? So they can really sort of help brainstorm how those conversations might go, maybe even role play those conversations, you know, really lend what mental health consultants bring in terms of their mental health background, you know, having difficult conversations often with folks, often negotiating relationship conflicts and things like that, and bringing that experience to help a staff member, whether it be a director or a home visitor or a teacher or others. In some rare instances, the mental health consultant could also go and be part of that conversation. So, you know, it's typically an indirect service in that the mental health consultant would build the capacity of the staff to be able to engage that parent or to be able to have those conversations. But in some instances, depending on the mental health consultation model, they could offer to go with the parent, go with the staff member to meet with the parent or to be at the meeting when the parent comes in and serve as kind of that relational bridge. And do sort of that brokering and really help, you know, sort of model a relationship in that way. The other thing that I think mental health consultants can really bring into a situation like this is help access community services, right? So they typically are from maybe a mental health agency or from some other, you know, agency in the community, or if they're not from an agency in the community, they're part of, you know, whatever community, hopefully, and know about those referral sources. So you mentioned as part of your question that sometimes families' needs are beyond the services of the early childhood program or the home visiting program. And so mental health consultants can help make those referrals or make those bridges to those other services, whether it might be shelter services, you know, services for an interpersonal violence situation, whether it would be a food bank or connecting with child welfare. That in particular can be a really hard area for early childhood programs, as if they have to make a referral to child welfare. And so they can certainly be helpful in those kinds of conversations as well. Substance use disorders. You know, we know that has been on the rise recently with the whole attention to opioids, and consultants can help, you know, access those treatment options, or again, have really tough conversations that sometimes staff find themselves in and don't necessarily feel prepared.
That's great. And I think what you just shared kind of answers the question we had. So the question we had was around issues of parents who aren't cooperative in the process, is what I'm quoting. They find that it limits the progress the teacher can accomplish when the parent doesn't collaborate. And I'm thinking, Amy, you might want to comment on this, or Neil. I'm thinking that some of these bigger issues, you know, when teachers are kind of not able to connect deeply with a family, it might be because of these bigger issues, or it might be that they just need the support of someone to process what's happening and figure out a different strategy to build a relationship with that family member. But do you have thoughts about that?
Well, I mean, I guess just to piggyback on what you were saying, my thoughts on that would be it's so complex, right? I mean, it's a really complex situation in terms of what does that relationship look like? How did that relationship begin? Where, you know, what was the premise for that relationship to begin? Did it sort of begin when things were already a little bit difficult? And so then you need to sort of step back and, you know, figure out, well, how do we repair this relationship? I think that, you know, the consultant, as we mentioned, can be that person who can sort of support the staff to really think about, well, you know, here we are in this place. What can we do? What can we, how do we step back and reflect on what else haven't we tried? And for some parents, this may be the first time they're hearing any of these, challenges, or, it's certainly quite possible that these things aren't the same as what's going on at home. And, this may be just the beginning of sort of their journey. And so, the most important thing is figuring out how we can continue that relationship to support the child and the family.
Great. Thanks, Amy. So as we're talking, and we're getting close to the end of our hour together, as we're talking, and we name this conversation All Hands on Deck, because it seems to me that the reality is when we're doing this big work in the field or in the community, the big work of promoting young children's social emotional development to help them for a life trajectory, right, of wellness and social emotional skills, that we ought to all be working together to achieve this. There are far too few people who are working intensively to strengthen what happens in the early years for young children and their families. So Neil, I'm going to pass it to you to talk about this a little bit. What are thoughts that you have? How do we strengthen our services, our collaborations between infant and early childhood mental health consultants who seem deeply competent to help in this work, as well as our pyramid model implementation folks?
Yeah, so just so behind the scenes look for our participants, before the call started, Amy and Lisa were talking about a book that I pretended I knew something about just so I could be cool, which of course I didn't, because I only read nonfiction. But this question, Lisa, reminds me of a book that I have read. I know that's surprising that I've actually finished a book, Amy, but I did. The Boys in the Boat, which is this fascinating look at a rowing team in the 1930s, and it's got all kinds of other stuff. But what fascinated me, as somebody who doesn't do that particular sport, was how in sync people need to be to move something forward, and that every single person, just one slight sort of person not doing what they do, could throw things off. And when I think about, as you said, Lisa, this is a big, complex undertaking. I don't think that there's competition for work. I actually think that the approach that folks who are implementing the pyramid model take, or pyramid model coaches, or program-wide implementation, is equally important to what folks who are trying to implement mental health consultation are doing, and quite frankly, all the other things that people are trying to do in early care and education and in early childhood in general. And not only do we need to be on deck, but we need to actually be coordinated. As I watch people who are doing rowing or sailing or things that really require some synchronization, it really is important to start to think about, there's not a right or a wrong way. There's not the pyramid model or mental health consultation. It's actually both. And as I said, I think in the beginning, I think a lot of folks on the ground, I know, as I looked at the participant list, there are very specific people on this call who have figured out how to use those multiple lenses. And that, the role of a mental health consultant can be one that is supportive of some ongoing implementation of curriculum, of the pyramid model, of any host of things that happen within the world of early care and education. And my sense is that when we're all on deck and we've all decided this is what we're trying to do, we're trying to support the social emotional development of children, we're trying to support the adults who are working with those children and families. Part of it is, so what does that mean? And where am I rowing? And where are you rowing? And what are we trying to do? And what's our pace? And what are we doing? And are we talking with one another? We spend so much time in the pyramid model talking about relationships. That's all we're doing here, is we're talking about relationships. And I think that having that expertise that folks with the pyramid model implementation bring is really critical. And having the expertise that an infant early childhood mental health consultant brings is really critical. And it is not that one supplants the other, or you can only do one, or that they're the same. They are different things. They drive at some similar things, as do 20 other pieces of an early childhood world. And as this last little bullet point says, the field really needs both. And the more that we have these kinds of conversations, the more that we're all working together to figure out, what does it look like? Because the truth is, I don't think families care. They don't care what you call it. They don't sometimes even know that mental health consultation is called mental health consultation or the pyramid. They just want to make sure that their children are developing as successfully as possible. And as you said, Lisa, how do we all support the positive trajectory that we want all children to be on? And I think that when we're all on deck, when we're all sort of synchronized and working together, it can only enhance what's happening for young children and their families and for all the folks who are trying to support them.
That's great. So we don't want to forget mentioning your center and your resources. You want to share a little bit?
Sure. So this is a project that one of the things that's sort of most exciting about this in many ways is that it very boldly says SAMHSA, and all praise to SAMHSA for funding this. But what's really great about this is that SAMHSA is actually co-funding this with money from HRSA and ACF, from Health Resource Service Administration and the Administration on Children and Families. So these are big federal agencies that all are putting money towards this center to help support states and tribal nations, territories, and communities. And one thing that we've done is develop a toolbox that's really there for folks with lots of interactive materials, lots of resources to really help folks understand what is this all about, what can I do, how do I do some sort of assessment of where I'm at, how does this fit with everything that's already happening within my community, state, tribal nation, territory. We have sites that we're working with across the country and supporting them with some technical assistance, all in the hopes of really continuing to establish the field of infant early childhood mental health consultation and help people understand how this is one important and critical piece of the services and supports that are available in an early childhood system. So you'll see there the URL for the website. We really encourage you to go look at that. If you have specific questions, we are available at this email and actually answer. We actually look at it and say who's best going to answer this, and those questions have range. This center, as I said, what's most exciting is that a number of federal agencies are in support of this. We have folks from the Head Start world, the child care world, the home visiting, McV home visiting, maternal infant early childhood home visiting world. So any number of the sort of early childhood systems partners are in here. And again, it is about all of us having all hands on deck. And this center, I think, brings that to bear in terms of how we're addressing mental health consultation.
Great, thanks.
Yep.
So we are at the end. I want to thank the panel so much for presenting. Neil and Amy, there aren't two people in the world I would rather have a little discussion with, especially about this topic. I think it's so important. If you have questions for any of us, we all will answer our email, and our email addresses are here. So you guys, thanks so much for being here. I need to remind you to please, pretty please take the email survey. We really want your responses. It's very important to us that we get your feedback and that we have the opportunity to be responsive to that feedback. And remind you that you probably found the webinar through social media or challengingbehavior.org. Come back. We have a whole bunch of new products in the pipeline, as well as some exciting webinars coming up. So stay tuned, sign up for our newsletter, and continue to participate with us. So again, Neil and Amy, thank you so much. Thank you for all of you who have joined us, or those of you who are watching online.